Hi, my name is Triana Williamson and I'm the practice nurse here at Music City Plastic Surgery. I wanted to take some time today to walk you all through how to take care of drains at home. If you have a procedure here, you may come out with one or even two of these drains. It can look intimidating, especially if you're not familiar with it, but there's nothing I'm about to show you that you won't be able to handle at home. For starters, let's get familiar with them. Your drains will likely look like this, little bulbs, and they'll be attached to some sort of tubing. The tubing that's attached might be a little thinner, a little thicker, but they all work the same way. This white portion that you see here will actually be the part that's inside of your body. And then the clear tubing will be stitched to your skin. The rest will be kind of out of your garment, and then the drain or drains will be affixed to your garment somehow, maybe pinned, maybe clipped. The stitch just helps to ensure that those drains don't accidentally get pulled out. In terms of your responsibilities, when you are sent home with drains, you're going to be responsible for emptying the drains and for what we call stripping the tubing. We send you home during your pre-op appointment with a pre-op booklet. In that, there's a log where you're going to be documenting all of the output that you know in these drains. When you decide that you're ready to empty out your drain, you want to find one time a day that's going to be consistent and use that time to empty the drain. Before you empty it, you want to note how much drainage is in there, and there are little markers on the drain itself with numbers. You just write down that number, then pop the top, just like so. It's kind of like a pool toy. You squeeze it out, and then before closing that top, you want to make sure you continue to squeeze that bulb. Basically, by compressing it, you're ensuring that there's some suction to pull that fluid out of the tube and into the bulb. Again, your drain should never look like this when you shut it. We want that compression because that means there's vacuum. So squeeze, shut the valve, and you're good to go. You do that once a day, ideally the same time every day, and make sure and chart how much drainage is in there before you empty it. In terms of stripping the tube, it sounds more challenging than it is. You're going to take one hand and stabilize the tube. Get as close to that suture to your skin as possible. So using one hand to stabilize the tube, you're going to take the other hand and pull the tubing away. Then you're going to work that stabilizing hand down to meet the other and keep pulling. And you want to inch down all the way until you get to this bulb here. Debris, clots, sediment can get stuck in here, and we want to ensure that these stay open so that the drains are doing their job. You want to do this step 2 to 3 times a day. Or if you notice that your drain has been putting out a certain amount and it seems to be slowing down, you can always go ahead and strip it just to make sure that that's not the problem. The reason that documenting your output and keeping these drains open and getting an accurate output is so important is because that's our way to know that the drains are ready to come out. Some of you may find the drains to be annoying. You have to kind of find a place to put them when you're showering or whatever. The stitches can be a little uncomfortable for some of you, but it's worth it because all of the fluid that they're pulling out would otherwise be accumulating in your body and preventing that tissue from healing, and that's not what we want. So as eager as you feel to get those drains out, we want to keep them in while they're doing their job effectively so that we can make sure that you're going to heal. Making sure that you're documenting and getting an accurate documentation of that drainage is important so we can take them out as soon as they're ready. Otherwise, you guys are going to do a great job. Congratulations. And I look forward to seeing and working with you and taking care of you.